Pulmonary circulation is going to work a little differently than systemic circulation. This is because we have a much shorter distance. We're not trying to push blood all the way down to muscles in our feet. We don't have to move stuff nearly as far. And because we don't have to move the blood nearly as far, and we're not trying to send as much blood to those areas necessarily, we have everything much, much closer to hand. It doesn't take nearly as much force to do that. Just like if you're driving across a parking lot, you don't try and go 90 miles an hour in between those two places. You kind of go nice and slow, and it's fine just because you're staying nice and close. It's not like you're driving to California. Now, because of that, because we are moving the blood more slowly, that means we're going to be dealing with a lot less pressure. Less pressure means the blood vessels themselves, so our pulmonary arteries don't have to have nearly as much connective tissue. They don't have to have nearly as much elastic tissue in particular. They're under less stress, so that means they don't need to stretch nearly as much. And when I say different, I'm talking between 15 and 25 millimeters mercury pressure, whereas in the aorta, we're looking at 120 millimeters mercury pressure. That is a huge amount of difference here. Okay. So a lot less elastic tissue because we're dealing with a lot less force because we're moving a much shorter distance. Okay. Now, as we get pumped through the blood or through the pulmonary circulation, we're going to go, of course, from our right atrium into our right ventricle. We get pressed out through the pulmonary trunk, and this is where we're experiencing that 15 to 25. Then we enter our pulmonary arteries. Now we have rights and lefts so that we can feed, of course, right and left lungs. As we move through, we're going to then enter our pulmonary arterioles, and then finally we're going to enter the pulmonary capillaries. This is where our gas exchange is going to occur. So the pulmonary capillaries that are found around these little air sacs or the alveoli in our lungs. Look at all of the surface area that we have right here in this little cartoon. Okay, it means we're getting as much oxygen into the stuff as we can. Now, to help with getting as much oxygen into these as we can, we need to slow down even more. Okay. In our capillaries, but especially our pulmonary capillaries, we don't want that blood moving very quickly at all. That's going to allow as much oxygen to get in and as much CO2 to get out. Because remember, time is a big factor in diffusion. We are using diffusion here to move respiratory gases. Okay. So because of that, our pressure at this point is actually fairly close to zero. Then we are going to leave the pulmonary capillaries and enter the pulmonary venules. And then finally, so here's our pulmonary venule. Then we're going to enter the pulmonary veins. Now remember that we have 4 primary pulmonary veins. We have superior and inferior on both the right and the left. Then we drain into our left atrium at almost 0 millimeters mercury pressure. So basically just kind of draining in. Then we will enter our left ventricle, and that is when we get shot out through the aorta at our 120 millimeters mercury, or 120 over 80, is going to be right here in our aorta. Sometimes it's even higher. But because of that big difference in stretch, the aorta, of course, has to have massive amounts of elastic tissue, far less so in our pulmonary circulation.